Good evening, and welcome to Cross Currents, our weekly program dedicated to exploring today's most pressing issues. Tonight we delve into a particularly sensitive and increasingly debated topic. Are mental health diagnoses becoming too frequent? It's a question that sits at the intersection of healthcare, societal understanding, and individual well-being. Joining us to unpack this complex subject are two distinguished guests. Dr. Eleanor Vance, a clinical psychologist who brings a perspective of caution regarding current diagnostic trends, and Mr. Samuel Green, a mental health advocate who believes the rise in diagnoses signifies positive change and greater access to support. Welcome to you both.
Thank you for having me, James. It's an important conversation to have. I'd like to begin by acknowledging the significant strides we've made in mental health awareness over the past few decades. There's less stigma, and people are generally more open to discussing their mental well-being, which is undoubtedly a positive development. However, this increased awareness has coincided with a dramatic surge in diagnostic rates for conditions like anxiety, depression, and ADHD, particularly among younger populations. My primary concern is the risk of what some call diagnostic inflation. Are we inadvertently medicalizing normal human emotions and experiences? The everyday sadness, worry, or distractibility that are part of the human condition might be too quickly categorized as disorders. Furthermore, we cannot ignore the potential influence of pharmaceutical companies in this trend, nor the societal pressure for quick fixes. A pill often seems like an easier solution than addressing underlying psychosocial factors. Finally, the downsides of labeling can be significant. While a diagnosis can be validating for some, for others it can lead to stigma, self-fulfilling prophecies, or an over-reliance on medication without exploring other therapeutic avenues. My goal is not to dismiss genuine suffering, but to advocate for a more nuanced and cautious diagnostic approach, ensuring that we differentiate true pathology from the natural spectrum of human experience.
Thank you, Dr. Vance. Mr. Green, your opening thoughts?
Thank you, James, and thank you, Dr. Vance, for setting out your perspectives so clearly. While I understand Dr. Vance's concerns, I view the situation from a different angle. I believe the progress we've made in destigmatizing mental health is absolutely crucial, and the rise in diagnoses is, in many ways, a direct and positive consequence of this. For decades, countless individuals suffered in silence, their conditions unrecognized, misunderstood, or dismissed. The increased number of diagnoses today suggests that more people are finally feeling empowered to seek help and are being heard. This isn't necessarily diagnostic inflation, but rather a reflection of improved recognition and understanding within the medical community and society at large. We also have more sophisticated diagnostic tools and a deeper professional understanding of mental health conditions than ever before. What might have been overlooked or misattributed in the past is now being correctly identified. Crucially, early diagnosis often leads to timely interventions, which can significantly improve long-term outcomes and quality of life. For many, receiving a diagnosis is the first step towards accessing necessary support, therapy, and, when appropriate, medication. It's also important to remember that despite the increase, many individuals who genuinely need help are still undiagnosed and unsupported. Our focus should be on continuing to improve awareness, reduce stigma further, and ensure equitable access to care for everyone who needs it.
Thank you both for those comprehensive opening statements. Dr. Vance, Mr. Green argues that increased diagnoses mean more people are getting help who previously suffered in silence. How do you reconcile this with your concerns about overdiagnosis?
I absolutely agree that it's positive when individuals who are genuinely struggling receive help. My concern isn't with those individuals. It's with the potential lowering of diagnostic thresholds. Are we casting the net too wide, pathologizing milder forms of distress that might resolve with time, lifestyle changes, or community support, rather than a formal psychiatric label and medication? There's a significant difference between severe, debilitating mental illness and the anxieties or low moods that are often transient responses to life's stressors. Furthermore, the rise of social media and online self-diagnoses, while sometimes a gateway to seeking professional help, can also lead to misinformation and individuals incorrectly labeling themselves before consulting a professional.
Mr. Green, Dr. Vance raises points about lowering diagnostic thresholds and the influence of social media. How do you respond to these concerns?
Diagnostic criteria do evolve, and often this is for the better, reflecting a more refined understanding of conditions. What might seem like a lowered threshold could actually be a more accurate and inclusive definition that captures individuals previously missed. Regarding social media, it's a double-edged sword, certainly. There are pitfalls like misinformation or the tendency to compare. However, it has also played an undeniable role in raising awareness and creating communities where people feel less alone in their struggles. Ultimately, the key is that any self-recognition or information gleaned online should lead to a thorough assessment by a qualified healthcare professional. Social media can start a conversation, but it shouldn't be the diagnostic endpoint.
A question for both of you. What role do you believe the structure and pressures within our current healthcare systems play in these diagnostic rates?
The pressure on primary care physicians is immense. With limited consultation times, it can be challenging to conduct in-depth psychosocial assessments. Sometimes, prescribing medication or making a quick referral for a diagnosis can seem like the most efficient, albeit not always the most holistic, option.
I agree. Additionally, in some healthcare systems, a formal diagnosis is the only gateway to accessing certain therapies or support services. This can inadvertently incentivize diagnosis, even when alternative or less intensive supports might be initially more appropriate.
Furthermore, direct-to-consumer advertising of pharmaceuticals in some countries can also shape patient expectations and requests, potentially influencing diagnostic conversations.
And we must also consider the underfunding of comprehensive mental health care. If preventative services and early, low-intensity supports were more readily available, perhaps the reliance on formal diagnoses for any level of distress would lessen.
Moving on, Dr. Vance, if we are potentially over-diagnosing, what are some practical alternatives to applying a formal label, especially for milder cases of distress?
There are several valuable approaches. Firstly, a greater emphasis on preventative measures and building psychological resilience from a young age through education and community programs is vital. Secondly, stepped care models are crucial. This means offering low-intensity support first, like guided self-help, psychoeducational resources, or short-term counseling, before escalating to more intensive interventions or formal psychiatric diagnosis if needed. Holistic assessments that consider a person's entire context, their social support, lifestyle, work or school environment, and recent life events are also essential, rather than focusing solely on a checklist of symptoms. This helps differentiate between a clinical disorder and a reaction to adverse circumstances.
Mr. Green, Dr. Vance proposes stepped care models. How can we ensure that such models, while beneficial, don't inadvertently become barriers for individuals who genuinely require a formal diagnosis and more intensive treatment sooner rather than later?
That's a very important consideration. I agree with the principle of holistic and stepped care. However, for it to be effective and not a barrier, it must be adequately resourced, easily navigable, and responsive. Waiting lists for low-intensity services can't be so long that individuals deteriorate while waiting. There must also be clear pathways for escalation if initial interventions aren't sufficient. Furthermore, for many individuals, particularly those with more severe or complex conditions, a formal diagnosis is not just a label. It's a vital tool for understanding their experience, accessing appropriate treatments, and sometimes for obtaining necessary accommodations or support in education or employment. It can be profoundly validating. So while step care is a good ideal, it must be implemented in a way that doesn't delay or deny necessary diagnostic assessment for those who truly need it.
This brings us to a critical point. How do we balance the benefits of early intervention, which a diagnosis can facilitate, with the risks of premature or inaccurate labeling that Dr. Vance has highlighted?
A period of watchful waiting combined with supportive, non-labeling interventions can be appropriate for milder presentations, alongside a thorough, ongoing assessment process rather than a rush to judgment.
It's about the responsible use of diagnostic labels when they are clearly indicated, coupled with robust public and professional education about what these diagnoses mean, and, importantly, what they don't mean.
We are nearing the end of our discussion. Dr. Vance, would you like to offer your closing statement?
Certainly. I want to reiterate my concern that in our commendable efforts to promote mental health awareness, we may be inadvertently medicalizing the normal spectrum of human life. The rapid rise in diagnoses warrants careful scrutiny. My position is not about denying help to those who are suffering, but about ensuring that the help provided is appropriate, proportionate, and truly necessary. A diagnosis should be a carefully considered clinical judgment, not a quick fix or a response to societal pressures. We need a balanced approach, one that champions awareness and access to care, but also steadfastly guards against diagnostic excess and the potential harms of over-medicalization. Critical thinking, thorough assessment, and a focus on holistic well-being are paramount.
Thank you, Dr. Vance. Mr. Green, your final thoughts?
Thank you. I believe the increase in mental health diagnoses is, on balance, a largely positive development. It signifies that we are doing a better job of recognizing conditions that were previously hidden or misunderstood, and that more people are courageously seeking the help they need. For countless individuals, receiving a diagnosis and subsequent support has been life-changing, allowing them to understand their experiences and access pathways to recovery and a better quality of life. We mustn't underestimate this profound impact. Our continued focus should be on further reducing stigma, improving access to timely and high-quality mental health care for all, and ensuring adequate funding for these vital services. We must not allow an overly skeptical view of diagnoses to reverse the hard-won progress we've made in bringing mental health out of the shadows.
Thank you both, Dr. Eleanor Vance and Mr. Samuel Green, for a truly insightful and thought-provoking discussion tonight. You've clearly articulated the complex tension between fostering greater awareness and access to mental health support, and the potential risks of overdiagnosis and the medicalization of everyday life. It's a conversation with no easy answers, but one that is essential for us to continue having. We hope tonight's program has given our listeners much to reflect on. Thank you for joining us on Cross Currents. Good evening.